The spot for the program is Weight Loss Surgery Right for You. In the studio with us this morning, Dr. Brian Walkowski and Hayley Robson, the weight management team at IRMC is a very active and now accredited metabolic and bariatric center. We want to talk about that with them. And our visit this morning is presented by Marcus and Mack, voted the best law firm and the best personal injury lawyer 4 years in a row and the best of Indiana County contests. Visit them online at marcusandmack.com. I remarked a couple of moments ago to the two of you, every time you come, you're talking about the same thing. But that's okay because it's still a big problem for Indiana County and really all of American society. Sometimes we battle that weight war and it's too hard to get off. And so there are ways to get around that to repair the damage that you're doing by maintaining all of that weight. Dr. Walkowski, of course, you have just performed your 500th robotic surgery?
Yeah, that's correct. I got to Indiana in September of 2021 and have been doing robotic surgery since that time and just passed the 500 case threshold about a month or so ago. So very excited to have reached that landmark.
There was no balloon drop or confetti or anything
Well,
like
actually,
that?
there was a cake. So the the company that provides all the support for the robot and actually manufactures the robot, Intuitive Surgical, their rep, Alex, was gracious enough to bring a cake for it.
Yeah. Hayley, was the cake any good?
I didn't get to try any.
What?
I know.
What?
I know.
Hey, let's talk a little bit about what this new accreditation means. An accredited metabolic and bariatric center. It means, number one, you're doing it right at IRMC, but it really is something that certifies the fact that it's quality work and it's changing lives.
Yeah, so it took a lot of work, of course, from the young lady here on my right. She did most of it. Very thankful to have her. But yeah, we joined one of about 40 or so centers across Pennsylvania that have a bariatric accreditation as a center of excellence. And it's an ongoing commitment to standards, to quality, to patient outcomes. So we're just happy to join those ranks. It's been the culmination of years and years of hard work, not only from our providers, but dozens of people across the institution with administrative buy-in, people in the office, nurses on the floor, of course, Hayley, our dietitian, so too many people to name and thank, but it's been a group effort.
Hayley, I guess the evidence of it all is the success of the patients who have had the bariatric procedure because it's an ongoing thing, isn't it?
Absolutely. I mean, we see these patients annually after they've had their procedure, and right now we're seeing up to 4 years out. So it's great to see the success that these patients have had that far beyond their surgery, and it is something that's going to be continuous for the rest of their life.
Yeah. And one of the great things about it is you've got the outcome, the evidence right in front of you, and but the patients and the testimonials they give. I've had a number of them come in and visit with us on Indiana in the Morning. They talk about their joints feel better. They all of a sudden are able to do things that they haven't been able to do for years, playing with the grandkids, all of the different life changes that they're able to make simply because they finally got a handle on what has been an ongoing demon in their lives.
Exactly. I mean, it's more than just the physical aspect of the weight. It's mental. It's so much more than that, and our patients have vouched for it in multiple different aspects that it's successful.
All right, so there are plenty of patients out there or potential patients who need to be there on Tuesday, January 20th. You'll be at the S&T Wellness Center. The program is called Is Weight Loss Surgery Right for You? Dr. Walkowski, is it right for everybody? Who is the perfect candidate for weight loss surgery?
Yeah, it's. I'll be the first to say, and I tell my patients this right in the office, and that it's not for everybody. It has to be a total commitment to it, and that's not only the physical aspect, but the emotional, the psychiatric component. So it is not for everybody. And like I said, I'm the first to say that. But generally speaking, patients with a BMI and that's related to height and weight, but a BMI over a certain threshold, usually 35, if they have a weight-related condition like obstructive sleep apnea or diabetes or hypertension, qualifies them typically for surgery, or patients with a BMI over 40. And those are just the very general indications for surgery, but there's a lot more that goes into it and a lot of conversations that we have with the patient And once they establish with us, usually takes about 6 months to get through the process in the build up to surgery.
Yeah. Well, you talked about the psychological effect. Haley, you can weigh in on this as well. People have to have the right mindset heading into the entire process, and they'll learn about that at the session on January 20th.
Absolutely. I mean, mindset is probably one of the number one things that you need to have in order to be successful with this weight loss. We give you all of the tools, but you have to be ready and mentally prepared to make this change that's going to affect you for the rest of your life.
When we talk about motivations for having bariatric surgery, they can be well beyond anything that we might have imagined. Something going on in somebody's life that all of a sudden they say to themselves, you know, I can't do that, or I'm feeling this, and my weight is the reason for it. I have to get this taken care of.
You see that quite a bit, and I liken weight and our addiction to food and sometimes sugar as very similar to other types of addiction, in that people have to hit that rock bottom, and sometimes it's hitting a certain number with their weight, sometimes it's not being able to sit in an amusement park ride with their child, sometimes it's getting out of breath carrying some folded laundry. Whatever it might be, people have to be ready themselves prior to making that appointment. And that's what they often tell us, that there was something that broke the camel's back, and they're only coming in to see us now because they know there's really no other way forward aside from surgery, that they've tried everything else and it just hasn't worked for them, and they want to break that mold.
It's a lifestyle choice, really, when you
Absolutely.
get right down to it. All right, so let's talk about the procedure itself and what people will learn when they come to the S&T Wellness Center on the 20th.
Yeah, I tell people I offer two different types of surgeries at IRMC, the first of which is the gastric sleeve, which I'm actually removing about 2/3 of the stomach, makes for a much smaller reservoir, and thereby you're having decreased food and fewer calories, and also there's an appetite suppressing effect to it. So people lose on average about 60% of their excess weight there. And then with the gastric bypass, the other procedure that I offer, I'm rerouting some of the intestines on the inside and bypassing a segment. So not only are people not able to eat quite as much, but also there are positive metabolic components with the bypass segment.
Haley, are there questions that people bring to sessions such as this, because you've had them before, questions that are fairly common, and things such as, will I never really want to eat sweets again? And you know, what kind of changes is my family going to go through as well? You get those
Oh, absolutely.
typical
And
questions?
that is the point of the session. You know, bring your questions. Anything is on the table. I mean, no question is a stupid question. That's why we have this session, to be able to answer any question you might have. So we do encourage that. Do your research prior to the session, and come and see what we can get answered for you there.
I would guess that one of the questions people would bring is this going to be painful?
Uh, Well, I wish it would be totally not painful, but generally speaking, the patients recover quite quickly. They only spend one night in the hospital. Very seldomly do I actually prescribe narcotics post-operatively. They can get by with Tylenol, and we use multimodal pain control following the operation. So it's tolerated quite well, and people can usually return to work within a matter of a couple weeks.
And you talk about reaching the milestone with robotic surgery. I would assume that and really helps in that process.
Yes, absolutely. So I've seen it. I can say anecdotally that performing these surgeries on the robot decreases the torque and strain on the abdominal wall, and I just see it the next day with people. They feel well, and they're out the door within 36 hours. Whereas when I used to do these cases in fellowship, laparoscopically, I saw that the patients had a little bit more pain, not uncommon for them to stay 2 days or more. So I've seen it personally.
I remember Dr. Clark coming in talking on a number of occasions about robotics and the precision with which the surgeon is able to operate, and what a game changer that is.
Oh, yeah, absolutely. You have 7 degrees of wristed articulation with a robot. Everything is precise. It's meant to mimic open surgery, but then get the benefits of a minimally invasive approach. So it's been a game changer in the field of bariatrics, among others. I think it produces excellent reproducible results, and I've been a fan of it since day one.
So that is the procedure itself. Haley, after the procedure is done, and you mentioned the follow-up care and how you continue to see the patients. Talk about that, the initial stages afterwards, and then as it progresses down the road, and you get a little bit further down the road from the surgery itself.
Sure. So we see all of our patients at least 1 week post-op. and then we see them at 1 month, 3 month, 6 month, and then annually thereafter. Obviously, if someone is having, some issues or anything like that, we see them more frequently, but that is the standard. At each of those visits, they visit with the same team members. So Dr. Walkowski, our dietitian, and we're following closely their vitamin levels, making sure they're getting their protein, their fluids, and consistently just monitoring their weight loss and their success with the surgery.
Yeah. Do you actually follow them to the shopping mall and help them with their new clothing because they're probably going to need
No,
some?
but we hear lots of them telling us about how they're dropping pant sizes, so that's
yeah?
the good thing.
Yeah, you get to do some extra shopping. That's not a bad thing.
Right.
No.
It's not a bad thing. But we're talking about lifestyle changes that are a whole part of the bariatric surgery process. And IRMC, as we said, continues now accredited metabolic and bariatric center. The whole team has to be proud of that, but the entire hospital community and the way this program has grown has to be something that the whole community has to be aware of now.
Yeah, absolutely. I think we've gotten an excellent reception from the community, from the hospital at large. It started, with our administration committing to the process about 4 years ago, bringing me on board, telling them that it was going to be years in the making, that there was going to be a lot of moving parts, is going to require support with numerous personnel, a financial commitment, and they were great and very supportive from the outset. So it's been years in the making. We needed to hit a certain case number, threshold, certain outcomes, have everything documented. So it's been a long process, but also very rewarding. And I've thanked all the people that have had a role to play in it, but it's been many, many people that have had their hands in this.
The event at the S&T Wellness Center is weight loss surgery right for you. Is at 6 p.m. That's along Shelley Drive in Indiana. Tuesday, January 20th. You can register online. You can also just call 724-357-7188. If somebody really wants to get in with the weight management program there, and they want to make a consultation appointment, what should they do?
So they should call our office, 724-349-3170, and they will put them through to Hayley, and she'll have some preliminary questions for them. And it's as simple as that. We'll get that patient right on my schedule.
They can be referred by their primary care physician as well?
Absolutely. So most of the primary care or even specialty doctors know how to refer to our office. And if once I receive the referral, I'll give the patient a call and talk about getting them scheduled.
There you go. There you go. That number that Brian gave you was 724-349-3170. If you want to go to the event on Tuesday, January 20th at the S&T Wellness Center, 357-7188. Folks, thanks so much for coming in.
Thanks for
Thank you.
having us.
We appreciate it. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Westwood One Sports next. Matt with us then from the WCCS Newsroom.